Well, today's Ask the Doctor segment all about varicose and spider veins, something a lot of folks are going to have questions about. Dr. John Eagan Jr. joins us. He's an interventional cardiologist from Cardiovascular Associates to take your calls. Here's that number, 741-9272 to ask the doctor. And let me just start by giving us in layman terms exactly what is a varicose vein.
Well, basically, Janet, again, appreciate you having me on today.
Yeah, glad to have you.
A varicose vein is just a dilated vein. It's a vein that you can see through the skin. So in layman's term, it's just a dilated vein. It may be a vein that's incompetent, has blood pooling in the vein. As veins become incompetent or abnormal, they begin to dilate, and you can see them through the skin. So that's basically a varicose vein.
Okay, and we most often see them in the legs. Yeah. And why is that?
Well, you can see varicose veins anywhere in the body, but most commonly in the legs because of pressure, and we're bipedal, we stand, and because of gravity, Earth's gravity, blood will pool in the lower extremities in the legs, and then therefore the veins will dilate, become incompetent, then you can see those veins stick out. But it could occur anywhere in the body, and it depends on gravity.
Okay. We do have our first caller. Shelley or Sherry, what is your question?
How would you get rid of the spider veins in your leg?
Well, Sherry, there's
How do you get rid of them?
Well, there you go. There's a number of treatments, and the first treatment, Sherry, is to start out with conservative measures, which is just walking, exercise, get the blood circulating, get the blood flowing. We can also use pressure to offset Earth's gravity, so we put pressure stockings, and you can elevate your legs, like in the evening. When you're sitting around, if you elevate it, drains those veins and drains the blood out of those veins. There are other treatments. We have non-invasive treatments or less invasive treatments, such as ablation, where we close those veins using different types of catheters techniques, such as laser, radio frequency, and there's some surgical techniques which we can get rid of those veins.
So you don't have to just live with them. You can do something about them. Is that
right, Janet? There's a lot of great treatments nowadays for varicose veins. We start out with conservative therapies to pressure the veins, get the blood flowing with exercise, but there are new treatments that we can use to close those veins and have it circulating to normal veins.
Okay, we have another caller. Sarah, what's your question about varicose veins?
Yes, I have had them for for the past 40 years, and like my legs, they hurt a lot. And they puffs out real bad. What can I do to get rid of them, period?
Right, Sarah. Well, again, there's a number of treatments that you can use to help those veins. One is to start wearing those compression stockings, about 20 millimeters of mercury pressure. You can buy those at any pharmacy. You can also buy those online. So that would help to get that blood to circulate through those dilated varicose veins. And then if they become really painful, it causes pain, throbbing, numbness, swelling, then you might need a procedure, and that could include an ablation where we close those veins using different catheter techniques that are minimally invasive.
And at what point can a varicose vein become something dangerous?
Okay, so Janet, in the United States, there's estimated between, say, 50 and 100 million Americans that suffer from varicose veins, venous insufficiency. Of that number of adults that have venous insufficiency, varicose veins, a small percentage, maybe 500,000 to 1 million, go on to have severe skin changes, ulcerations, infections, and could even have threatened limb loss. So that's a severe case of venous insufficiency. So if you leave it untreated, it can not only go from a mild case to a severe case where you have ulcerations, skin breaks down, becomes infected, and then you have a real problem.
Okay, so don't let it go. Don't let it.
Especially nowadays, we have such good treatments that are minimally invasive, low risk, with great results. It's something that can be treated very easily.
Okay. Dr. Eagan, thanks for being with us. We sure do appreciate it.